Now we'll complete our picture of the knee joint by adding the fibrous capsule which encloses it. Here's the knee joint with the joint capsule intact. On the medial side, the thin capsule is continuous with the tibial collateral ligament. But on the lateral side, the capsule is separated from the fibular collateral ligament. On the back of the joint, the capsule is thick and strong. The thickened posterior capsule prevents hyperextension of the knee joint. Here, we've divided the fibrous capsule to see its inner surface. It's lined on the inside with synovial membrane all the way around the joint, except at the back. At the back, as we'll see if we remove the capsule, the thin synovial membrane, here it is, passes forward around the cruciate ligaments, covering them on the front. Besides being the largest joint in the body, the knee joint is also much the most complicated. Before we move on to look at the muscles which produce knee movement, let's review what we've seen of the bones and of the knee joint. On the femur, here's the lateral condyle and epicondyle, the medial condyle and epicondyle, the adductor tubercle, and the intercondylar notch. On the tibia, here's the lateral condyle, the medial condyle, the tibial tubercle, and the facet for the fibula. Here's the head of the fibula, the neck of the fibula, the proximal tibiofibular joint, and the patella. Here's the medial meniscus, the lateral meniscus, the anterior cruciate, and posterior cruciate ligaments, the fibular collateral ligament, the tibial collateral ligament, the quadriceps tendon, the patellar ligament, and the joint capsule.
So let's look at some movement of the knee. Here's the medial collateral ligament. Watch the movement, inflection, extension of the medial collateral ligament. Okay. Here's the lateral collateral ligament. And you can see that the movement of the femur on the tibia, and also look at the ligament moving forward and back, and look at the whole movement of the whole joint here. You can also watch the patella and the patellar tendon. We'll just do that one again. Maybe watching the patella and the patellar tendon sliding in that fashion. See how the patella slides in the groove there, intercondylar space, intercondylar groove. Here we have the patellar motion from above, during flexion and extension, and you can see it slides in and out of that groove. Normally it should stay right in its intercondylar space. These are the primal pictures slides. Here we have what's called patellofemoral tracking. This is the tracking that should take place where that patella stays right in that groove in the intercondylar space. Here we see again the patellar ligament, and we see the course of it tracking. Let's do it again. And it should slide evenly and smoothly through that groove. And when sometimes there's an imbalance in the muscles, particularly the quadriceps vastus muscles, for the most part, it could be other muscles, but the vastus muscles, it will not slide in that groove and it'll create a lot of pain as the patient flexes and extends their knee. Here's more tibial femoral motion. And you see the posterior collateral ligament and the anterior collateral ligament, posterior collateral ligament, anterior collateral ligament. I'm sorry, posterior, anterior collateral ligaments. And here we see another one. These are so cool, I just thought I'd put them all in. You can see the collateral ligaments. And here's the lateral collateral ligament and the cruciate ligaments, I said collateral, I meant cruciate ligaments. Let me look at this one again. So the cruciate ligaments, anterior and posterior cruciate ligaments. And the medial collateral ligament, the lateral collateral ligament, the anterior and posterior cruciate ligaments firing. Okay. So with those in mind, then the patellofemoral stress syndrome has to do with something called the Q angle. And the Q angle is increased in patellofemoral stress syndrome. We'll show what the Q angle is in a minute, but it's usually due to a decreased function of the vastus medialis.
There are 4 major ligaments that stabilize the knee. The medial collateral ligament is on the inner side of the knee, and the lateral collateral ligament on the outer side. The collateral ligaments give sideways stability to the knee. Two ligaments cross in the center of the knee. They are called the cruciate ligaments. The ligament toward the front is the anterior cruciate ligament, or ACL, and the one towards the back is the posterior cruciate ligament. The ACL prevents the lower bone, the tibia, from moving forward, and the PCL prevents it from moving backward. If the ACL tears, the tibia can move forward too much, and the knee can be unstable. The knee in which the ACL is torn tends to give out when pivoting or quickly changing direction. To correct this instability, a new ACL can be made. The strongest graft that is available to replace the torn ACL is the middle third of the patella tendon. This graft has a plug of bone taken from the patella or kneecap on one end and from the tibia on the other end. These plugs of bone are important because they provide solid fixation of the graft. This animation will explain how the middle third of the patella tendon is used to reconstruct a torn anterior cruciate ligament.
Up in the air in pain, it looked like Ashley Cole there, Martin. There he goes there, look. Just goes to pull it back in. Oh, look at that left leg get stuck in the ground. It really made him leap in the air with pain. Really jarred that knee up of his, didn't it? You could see the left leg. Watch the left leg, I think it studs into the floor as he's pulling himself up here. There it goes, left leg into the floor here. Look at that. Twists from underneath him. Ankle goes. It twists the whole shape of his leg around, didn't it?
It's a huge issue in the game at the moment about...
I'm a specialist in finding things to worry about, but even I didn't consider the prospect that Michael Owen, with nobody near him in the first few minutes, would struck by this horrific injury. What was this about?
Well, I have to say it. I hope I'm wrong, but it looks a bad one. It really does. I mean, you know what it is so often when no one's around you. They're often the worst ones, and it really does look a bad one. I mean, I've had a text of him saying he's in a lot of pain, and he hopes it's not bad, but obviously he's like the rest of us, I think, and fearing the worst here.
You'd be very surprised if he takes any.
You can't look at this clip too many times.
Pops it, you know, and it's absolutely tragic for Michael, and he's fought his way back from an injury, and he was just getting fit, and then this happens, and we all feel for him, we really do.
I think he knows that it's really bad, because you normally stay on the pitch and wait for the train to come on. He crawls off because he knows he can't take any more part in that game, and it looks bad.
Vale, ya está grabando. Nada, simplemente enfócame a mí ahí, ¿vale? La pierna, la rodilla, a mí no, la rodilla, ¿vale? Sí. Que se vea el movimiento este, ¿ves? Se ve, ¿no, Aurora?
Sí.
Vale. Ya.
¿Eso que tiene los ligamentos rotos?
Sí. Ya está.